Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. The GOP-led General Assembly spent the first week of the special session debating how restrictive new abortion legislation will be.
The restrictions on abortion here in Indiana are already extreme. We don't need any more restrictions.
Pro-abortion rights and pro-life activists made their voices heard. School is starting up around the state, and many communities are facing a large shortage of teachers. But Monroe County schools are the exception.
Bloomington, we're definitely more fortunate than a lot of other places, but it's still difficult.
Ahead, we talk with Indiana's former superintendent of schools. And as monkeypox cases are beginning to surge across the country, we'll tell you what you need to know. We'll have these stories, plus the latest news from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. The Indiana Senate rejected an effort Thursday that would have deleted rape and incest exceptions from its proposed abortion ban. Republican Mike Young proposed an amendment that would have limited exceptions in the ban only to when the life of the pregnant person is at risk. But after 2 hours of debate, 18 Republicans joined Democrats in voting against Young's proposal. The Senate is scheduled to vote Saturday to send the abortion ban to the House. Well, the debate on an abortion ban isn't going on only inside the House and Senate chambers. Pro-abortion rights and pro-life activists rallied at the State House this week. Dominic Cabe has this story.
Indiana's abortion debate is happening before a national audience. As lawmakers this week heard hours of testimony, chants of "My body, my choice" could be heard in the chambers. The protests were organized by a number of advocacy groups, including the ACLU of Indiana and Planned Parenthood. They say thousands of Hoosiers are against the state legislature's plans to ban abortion.
The restrictions on abortion here in Indiana are already extreme. We don't need any more restrictions. They need to trash this bill.
Rebecca Gibran is the CEO of Planned Parenthood Great Northwest, which oversees 4 states, including Indiana. She says the group will help patients access abortion care in other states.
Planned Parenthood across this country is mobilized. We are ready, and we will not turn our backs on anyone in this country in a banned state.
While abortion rights supporters object to the bill's tight restrictions on the procedure, abortion opponents argue that the proposed bill is too lenient and lacks enforcement teeth. Indiana Right to Life, the state's most prominent anti-abortion group, organized a rally that also drew several hundred protesters to the State House. Kathy Humbarger was a longtime leader of the Fort Wayne-based Right to Life chapter. She says the bill does not go far enough.
I know people who have been raped. It's awful. It's a horrible, horrible situation. We need to ask ourselves if the baby should be punished by having its life taken away.
State House leaders admit they're struggling to deal with issues they hadn't faced before Roe v. Wade was overturned, and that listening to everyone and trying to find a path forward is difficult. Right to Life activists read letters on behalf of U.S. Senator Mike Braun and 2 members of Indiana's congressional delegation in support of state GOP's plan to restrict abortion.
Abortion is one of the worst human rights tragedies today, and I think it is so important to stand like somebody stood for me years ago.
New national polling shows Indiana's proposal is at odds with most of the public. Overwhelming majorities who responded to the Associated Press poll believe their state should generally allow abortion in specific cases.
They won't stop at Roe! They won't stop at Roe!
For Indiana Newsdesk, I'm Dom Hyatt.
The Senate and the House will consider each other's bills next week and make any amendments before voting on the final version. Well, Vice President Kamala Harris advocated for reproductive rights Monday during a roundtable with Indiana state legislators. As Violet Cumber-Weiland reports, Harris and Democrats emphasized that the right to choose is essential for women's reproductive health.
The roundtable comes as a special session begins in Indiana. Republican lawmakers are pushing for a near-total ban on abortion with limited exceptions. Harris says this ban will strip women of their right to necessary care.
For the vast majority of women, by the time she realizes she is pregnant, she will effectively be prohibited from having access to reproductive health care that would allow her to choose what happens to her body.
Democratic Indiana Senator Greg Taylor furthered this point at the roundtable. He says losing access to abortion will have devastating consequences for women in Indiana.
This is the beginning of a process that, if successful, will have deadly outcomes for pregnant women in the state of Indiana that already has the third highest maternal mortality rate in the country.
He adds Indiana's already high maternal mortality rate will only get worse if abortion is banned in the state. For Indiana Public Broadcasting, I'm Violet Cumber-Weiland.
The IU Bloomington chapter of the American Association of University Professors passed a resolution deploring Attorney General Todd Rokita's attacks on Dr. Caitlin Bernard. The chapter also called on IU senior administration to defend Bernard against actions they described as baseless and damaging. Bernard drew national attention after performing an abortion for a 10-year-old rape victim from Ohio.
If someone like Attorney General Todd Rokita can speak out and vilify her and investigate her in this way, then I think this poses a threat to academic freedom in general.
The chapter wants IU senior leadership to issue a statement of support for Bernard. The resolution passed with a 62-1 vote. As a new school year begins across the state, many school corporations are facing teacher and staff shortages, but it's an issue the Monroe County Community School Corporation has managed to mostly avoid. Pat Bean has this story.
The sound of lockers slamming and students' voices will soon fill the hallways as another school year begins next week. But schools across the state won't have as many teachers for those kids as they need. One look at the Indiana Department of Education's Job Bank website tells the story. There are more than 2,000 open teaching positions and more than 3,000 vacant staff positions. And that's just the schools that are reporting data.
There have been a lot of people who would have been in the profession, maybe not even a teacher, maybe an aide, a para, a bus driver, a cook, or even just some of our volunteers.
And they just decided either during the pandemic or after the pandemic, you know what, I'm just not going to do that anymore.
Farmer is the president of the Monroe County Education Association, which represents more than 800 teachers. He says, unlike much of the state, MCCSC has just a handful of open positions, which is normal at this time of the year.
Sometimes we'll have a few specialty positions that it may take into August, before we're able to fill everything.
One thing working in MCCSC's favor has been the ability to increase teacher pay, thanks to referendums passed in 2010 and 2016 that generated nearly $17 million. The school system is asking voters to pass another referendum this fall that will raise $15 million and give teachers an additional $4,500 annually.
Fall of 2015, our starting teacher salary at the bachelor's was $32,000. If the referendum passes this year, the starting salary, once we iron everything out, is going to be $50,000. We've done that in 7 years. That is incredible. But we've only been able to do that because of the support of our community.
Statewide, the average starting salary was just over $38,000 for the 2021 school year, according to the National Education Association. The average salary was $53,000. Farmer did say that while the starting salary at MCCSC has gone up significantly, the top end of the pay scale hasn't.
Our focus has been those first 5 years, because nationally, in a national debate of public educators, it's well-known research, over half of all teachers leave the profession after 5 years. We just can't have that.
Because of the university, Bloomington can be a transient place, and Farmer says the school turns over anywhere from 85 to 100 teaching positions, about 10% every year. For Indiana Newsdesk, I'm Pat Bean.
We're joined now by Jennifer McCormick, Indiana Superintendent of Public Education from 2017 to 2021. Jennifer, welcome to the show.
Thank you for having me.
So kids headed back to schools already, but state's job board shows more than 3,000 education jobs remain unfilled. Now, not all those are teachers. Why is it so hard for the state to attract teachers right now?
You know, it's tough everywhere. Across the nation, it's really hard. But Indiana's really struggling in particular because I believe, 15 to 20 years of rhetoric that was very anti-education, anti-public education, anti-educator, in addition to some really questionable policies over decades and the lack of funding. So it really is a combination of a lot of things that are driving this huge crisis.
What would you like to see done to reverse that?
Well, it's going to take leadership. So I don't think you're going to change the minds of those at the State House. I think you have to change the people. I commend our local superintendents, our local school boards. They're doing everything they can, but you have to have a state, including a governor, who is very, very pro-public education, which 90+% of our students are sitting in, who will make the changes necessary to entice those to come back into the field.
You tweeted that public education in Indiana is facing a perfect storm. What did you mean by that?
It really is, and it's unfortunate, but we are under a situation where I think it's layered. So first of all, COVID, the pandemic, did not help us. So we're staring at 3 to 5 years before students reach a level pre-pandemic of their academic success. And that is alarming. And everybody, the special session that's happening right now, none of that conversation is happening. And it should be up front and center. The other thing, too, is Indiana has gone to credentials for teachers, which means no degree and no license. So a person can have essentially nothing in their background to become a teacher, and the quality then becomes obviously in question. You have school choice that has very limited accountability, and you have some discriminatory practices in enrollment. You have a lot of fiscal waste happening. The accountability with the academic piece is questionable. And then on top of that, you have that supermajority piece with the leadership that doesn't seem to have an appetite to address any of it. So, I'm a mom. My child is through K-12, through higher ed, and off serving in the military. But I have to be honest, if I was in the situation where my child was K-12, I would be very concerned.
The General Assembly spent a lot of time on bills banning critical race theory or regulating what teachers can and can't say, and you addressed a little bit of that. Ultimately, they failed, but what does that say to teachers about how the state then sees them?
Yeah, it goes back to they're just making stuff up. I mean, it goes back to leadership again. K-12 in Indiana, we do not teach critical race theory. It's just a national piece that a lot of people and organizations that were pushing the privatization of education hooked onto and worked it really hard. In addition to our past president jumped on that as well. So, the critical race theory piece is very unfortunate because we have real issues to address versus those that are just at this point being made up.
All right, we're out of time. Thanks so much. Appreciate it.
Thank you. Have a great day.
Okay. Well, Monroe County Board of Commissioners approved $10 million for the purchase of land for a new jail. Commissioner Lee Jones says there's a sense of urgency to act on a new jail.
If we don't take this step, it is likely that the feds will come in and require us to build a new jail. And this would all happen without public input from our community.
The current jail in downtown Bloomington opened in 1984, and Jones estimates it would cost around $60 million to renovate. The site for the new jail covers almost 90 acres in southwest Bloomington near the intersection of Fullerton Pike and I-69. County officials hope the jail will be constructed by 2024 or 2025. 25. Coming up next on Indiana Newsdesk. Indiana health officials are on high alert as monkeypox cases are spreading to all corners of the state. And summer nights are getting warmer, and that could lead to increased health issues. Those stories and more right here on Indiana Newsdesk.
Wake up.
Wake up to the world.
To the marvels, the mayhem,
the music.
Wake up to the wows, the woes,
the wonder.
Wake up to the commotion, to the beauty,
to the humanity,
to the hope. Wake up every morning, fully awake.
NPR Morning Edition.
Tune into your local station or download the NPR app.
Your favorite member benefit is getting better and bigger.
This is wonderful.
Over the next year, Passport is adding new shows and doubling the number of episodes for you to stream.
They've given us all that they've got.
From your favorite cooking and travel series.
Even the stairs are breathtaking.
To history specials and award-winning documentaries. Better and bigger.
That really is the fun part.
Stream on any device with Passport on the PBS Video app.
Welcome back to Indiana Newsdesk. Epidemiologists estimate the state is a few weeks out from the peak of its BA.5 wave of COVID-19 cases. The availability of at-home testing means the state is only capturing a small chunk of total cases in Indiana. Reinfections account for more than 1 in 5 reported positive cases, and hospitalizations are at their highest point since late February.
We are clearly in a very significant rise in number of cases of COVID and the number of admissions of COVID. And we're expecting that to peak out somewhere around the second week of August.
In addition to being fully vaccinated and boosted, Steinecker says most Hoosiers can protect themselves by seeking early treatment if and when they test positive, and he recommends specific masks for people who have to go into crowded places. Well, the World Health Organization recently declared monkeypox a global health emergency. The disease has been found in nearly every state, including Indiana. But is the state ready to handle an outbreak? Mitch Legan spoke with the State Department of Health.
Health officials are closely monitoring the spread of monkeypox in the state. They're urging Hoosiers to be cautious, but not to panic.
We've really started to ramp up all of our different teams that work on these different aspects, whether it be vaccines, logistics.
The disease is a cousin of smallpox and is spread through fluids, contact with an infected area, or prolonged face-to-face contact. Those infected might develop a fever and muscle aches before getting a rash with white bumps.
It's not like really COVID where, okay, I was in a large room and maybe someone had it there, but it's really those kind of close contact situations.
45 cases of monkeypox have been confirmed in Indiana. The Department of Health has reported cases in at least 12 counties in all corners of the state. So Weaver says they're positioning vaccines and antivirals in targeted locations for easy access in case of an outbreak.
Many are men who have sex with men, but we have cases in women and even cases in children here in Indiana.
Weaver says the limited number of monkeypox cases makes sharing specifics difficult, but the number of Hoosier women who have tested positive is above the national rate.
We've already started a lot of the same things we implemented on the outset of COVID, having conversations with our providers across the state so they know what's available when it comes to vaccines and also antivirals, treatment, what's available, making sure that this is on their radar.
The state currently has enough vaccine doses for 1,500 people. Federal health officials just announced more doses will come, but Indiana officials aren't sure when they'll arrive. So Weaver says they're following CDC guidance and, unlike COVID-19, they're focusing on vaccinating people after a potential exposure.
If you get that vaccine within 4 days of your exposure, it can actually prevent you from getting the monkeypox. And if we give the vaccine between 4 and 14 days after exposure, it can significantly reduce your symptoms.
Weaver says they're starting to expand vaccines to people at high risk for exposure and severe disease. Then they're hoping to open up to people just at high risk. They'll have to balance current needs with the potential for a future outbreak.
We're really anxious to get that process started, especially if we hear from the CDC kind of the timing about when we're going to get that next allocation. That'll help us feel more secure in pushing the vaccine out for pre-exposure.
Of the 20,000 cases globally, only 5 people have died. Nobody in the U.S. has died from monkeypox, but officials say preparing the state's health infrastructure will be key to keeping it that way. For Indiana Newsdesk, I'm Mitch Legan.
Mitch is here to discuss the latest on monkeypox. Mitch, you've been talking with health experts the last 2 weeks, but it's my understanding this is the first time we've been talking about monkeypox.
No, yeah, we actually had an outbreak back in 2003, but it was a lot smaller than what we're seeing now. Nationally, there were only about 50 to 70 cases, and they were confined to the Midwest. Here in Indiana, we had 15 cases, and all of those cases in 2003 were actually the result of people having prairie dogs as pets. So it's a lot different than what we're seeing now. Our outbreak is a lot bigger, about 5,000 cases in the U.S. as of this morning, and in Indiana, we had 45 cases. So that's triple what we had in 2003. And what's really concerning health officials about this is obviously we're seeing it here in the U.S., we're seeing it in countries where we don't normally see monkeypox. And at least at the beginning, a lot of this transmission was through sexual contact. So that's something officials are keeping an eye on. We want to make sure we know how this is spreading so we can kind of stay ahead of any potential major outbreaks.
So you've been working with some of our colleagues to try to figure out why this is spreading. What did you guys find out?
Yep, so as Dr. Weaver said, it's not like COVID, so it's not something people should be freaking out about. But it does seem like this is spreading in a bit of a different way here in Indiana. Globally, 99% of all cases are among men, and 98% of those cases are among men who have sex with men. I wasn't able to get specifics on Indiana's demographics because Dr. Weaver said that would be a privacy issue, but our colleagues up in Indy were able to get a hold of a Department of Health document that showed that we do have cases in women and children. We have 2 cases in children and at least a handful of cases in women, and both of those numbers are above the national rate.
So it's interesting to hear you say this is most about men who have sex with men, but yet some women, children. Yep. How concerned should Hoosiers be about this right now?
Yeah, so it is spreading. That is concerning, but again, it's not something people should be freaking out about. Health officials say that spread shows that people should be aware of this. They should, maintain caution. Just be aware of how this spreads and try to cut down on those very close contact situations that we've been discussing. A lot of the conversation, as you said, have been about the men who have sex with men, the gay and the bisexual community, and that does make sense because a majority of these cases are there. When I spoke with one of the top professors at the Kinsey Institute at IU here in Bloomington, his name's Bill Yarber, and he was actually tasked with writing the first school curriculum on HIV back in the 80s. He was a really interesting person to talk to. He said messaging around this is going to be really important, because if we kind of make this out to be a gay disease, that's going to create stigma. And he says that could lead to even more spread here in Indiana.
When that happens, those individuals may not seek treatment or diagnosis as quickly because of the stigma. They may not feel safe with the healthcare community. And then they may not disclose this to anyone else or family or something.
So the health officials that I've been talking with say testing and vaccinations are going to be key. We have 1,500 vaccine doses here in Indiana. We are expecting more from the feds. We don't know when that's going to happen, though. So we're going to have to make do with what we have and just, try to balance that potential future outbreak with the current cases. And we're just going to keep an eye on this as it continues here in Indiana.
All right, Mitch, thanks so much for your reporting on this. Definitely something we're going to keep an eye on.
Absolutely. Thank you, Joe. Interesting.
Summer nights across the U.S. are warming twice as fast as summer days. That's according to the independent researching and reporting collaboration Climate Central. Indiana Public Broadcasting's Rebecca Thiel reports extreme heat at night can be dangerous to your health.
Average summer low temperatures have warmed by at least 1 degree since 1970 in most cities studied in Indiana. Indianapolis had the biggest increase, with summer low temps going up by more than 3 degrees. Beth Hall directs the Indiana State Climate Office and the Midwestern Regional Climate Center. She says when temperatures don't cool down enough at night, our bodies don't get a chance to recover from the extreme heat during the day. It can affect how well we sleep.
We might be sweating more because that is our natural mechanism to try and cool off. So we could be losing more water that will make us more dehydrated over the nighttime hours.
Warm nighttime temperatures are especially dangerous for people vulnerable to extreme heat, like lower-income residents, young children, seniors, people with chronic illnesses, and those who work outside.
Where historically, that's when the temperatures cool off. That's when we could open the windows at night and we get a break from those oppressive daytime temperatures.
For Indiana Public Broadcasting, I'm Rebecca Thiel.
And Indiana enters the 2022 football season with much lower expectations than it had last year. The Hoosiers were picked to compete for a Big Ten East title in 2021. This year, they're picked to finish last in the division. At the Big Ten Media Days in Indianapolis this week, IU head coach Tom Allen says the Hoosiers, who finished 2-10 last season, can use that as motivation.
You either feel sorry for yourself or you sit there and do a thorough evaluation of everything that you do, which is what we began in January, and had a chance to go through that process, make changes, add some new players to our team, add some new staff to our program, and then allow us to get back to work.
IU opens this season at home against Illinois September 2nd. That's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.